In the U.S., nearly 10% of men and 20% of women have gallstones at some point in their lives. And usually, gallstones are most common after 60. We spoke with Dr. Frank Lee of Redlands Community Hospital in Redlands, California, who discussed the symptoms and the treatment of gallstones.
Gallstones basically are stones that develop in the gallbladder. So we need to understand a little bit of the anatomy of the biliary system. The liver actually makes bile, and the bile gets transported into the bile duct, and then it gets stored in the gallbladder. And when we ingest a meal, then the food stimulates the gallbladder to contract the bile into the bile duct. And then the bile then goes into the duodenum to mix with the food that we eat so that we can digest the food. And over a period of time, stones can develop in the gallbladder. There are usually a few processes that determine the formation of gallstone. We're mostly focusing on cholesterol stone at this time because cholesterol stone is the most common.
Dr. Lee explained gallstone symptoms.
80% of patients with gallstones have no symptoms. The stones are just there, causing no symptoms. Only about 20% of the patient will develop symptoms, usually over a period of 15 years after the gallstone develop. The classic symptoms of gallstone is what we call biliary colic. It's a classic dull, ache, intense discomfort, and usually occurs about 1 hour to 2 hours after you ingest, especially a fatty meal. And the pain can last up to about an hour, which is very intense, but then it can last up to about 6 hours as the pain intensity goes down. The pain can also go to the back and also go to the right shoulder area. Those patients who have recurrent biliary colic type of pain will need to have the gallbladder taken out. Also, when the stone actually dislodges down in the very lower part of the bile duct, when the pancreatic duct also joins together. At that junction, right where the bile duct joins together with the pancreatic duct, if the stone gets stuck in that area, it can also cause pancreatitis. And people with pancreatitis have severe mid-abdominal pain in the upper area, and pancreatitis can also make people very, very sick. And those people with acute obstructions that is life-threatening then will require a special procedure called ERCP, where a gastroenterologist will introduce a scope inside to the opening of the bile duct, where instruments can also be introduced inside the bile duct, take pictures of the bile duct, and to be able to remove the stone to relieve the obstruction.
Dr. Lee told us how you can prevent gallstones.
There are only certain things that we can do to prevent gallstones. Mostly is related to lifestyle measures. Maintain a healthy diet, stay away from fatty food, high cholesterol type of food, maintain a healthy body weight because obesity is actually a risk factor for gallstone development. Regular exercise regimen, and also stay away from some of the medications that may predispose to gallstones. Some medications such as oral contraceptives, certain type of antibiotics may actually predispose to gallstones, and stay away from those may actually help preventing gallstones. So nowadays, cholecystectomy are done very commonly, and most of the time it's done laparoscopic approach where it only involve a few incisions, and so the recovery time actually is quite minimal. Actually, most of the cholecystectomy, if it's done non-urgent basis, is actually done as an outpatient. So patient comes in, get the procedure, the surgery done, they actually go home the same day and recover quite well.